So next one, compare with males. In the females there is more chances for STIs because of in the females through the vagina the bleeding takes place and fluid discharges takes place. There is a chance for more infections for the females compared with the males. And absence or less significant symptoms in the early stages or infections and the social stigma attached to the STDs deter the infected persons from going for timely detection and proper treatment. Absence or less significant symptoms, completely symptoms are absent or less significant. The most important symptoms are not exhibits in early stages of STDs, less significant symptoms in early stages of infections, and the social stigma attached to the STDs deter the infected persons from going for timely detection and proper treatment. Whenever the people are not exhibits symptoms, in the people there is no symptoms, so they will not consult the doctor, and obviously they will not consult the doctor, and properly detection and treatment is not takes place. And whenever the symptoms are more, then they will consult the doctor, and that time the infection spreaded throughout the body, and infection spreaded to their partners also by the sexual intercourse, right? This could lead to complications later, which include pelvic inflammatory diseases, PID, abortions, stillbirth, ectopic pregnancy, infertility, or even cancer of reproductive tract. So whenever the people are suffering with STIs, there is some of the STIs symptoms are presented in their body, and along with some of the other complications also. This could lead to complications later, which include pelvic inflammatory diseases, PID, pelvic inflammatory diseases, PID. Pelvic means what? Pelvis region of the females or males. Pelvis region means near to the genital organs. Inflammatory diseases, inflammation, there is pain, itching, burning sensation. Inflammatory diseases, PID, one more abbreviation, pelvic inflammatory diseases. And abortions, those people are suffering with STIs. For the females, abortions are takes place. So abortions. And stillbirth means the females give birth to the child, those childs are dead child. So whatever the newborn child or dead childs, by the birth only those people are death, those childs are death. That type of birth is called as stillbirth. And ectopic pregnancy. Ectopic pregnancy means whenever the implantation takes place in which region? Uterus region. But outside of the uterus means in the region of fallopian tube the implantation occurs. That is called as ectopic pregnancy. Ectopic pregnancy means the embryo not implanted in the region of uterus, in the region of fallopian tube there is implantation takes place. That is called ectopic pregnancy. And infertility means what? There is no children, or even cancer of reproductive tract. There is a chance for cancer also occurs to the reproductive tract. So these are all the different types of the complications. So those people are suffering with STIs, and those people are not properly treated with STIs. And this could lead to complications later, which include pelvic inflammatory diseases, PID, abortions, stillbirth, dead child, give birth to the dead child, and ectopic pregnancy. So pregnancy implantation occurs outside of the uterus in the fallopian tube. Infertility, there is no children, or even cancer of reproductive tract also. So these are all different types of the complications. And STIs are a major threat to a healthy society, obviously. So when reproductive healthy society is maintained, earlier we discussed that reproductive healthy society is maintained whenever all the reproductive organs is in a healthy condition only. Those people are suffering with STIs. So all the people reproductive organs is infected, and obviously it is not considered as reproductive healthy society. STIs are the major threat to a healthy society. Prevention or early detection and cure of this disease are given prime consideration under the reproductive health care programs. Prevention and early detection and cure of this disease are given prime consideration under the reproductive health care programs. Earlier we discussed RCH, reproductive and child health care programs. So the motto of RCH is prevention of STIs and early detection and the cure of this disease are given prime consideration under the reproductive health care programs. Prevention, early detection and cure of these diseases. Which one is curable? 15 to 24 years age group persons are mostly affected. This is the most important point for you people, students. The STIs are infected to which age group persons? 15 to 24 years. The young age, teenage, young people only will affected majorly by the STIs because of more sexual contacts with unprotected sexual contacts in this stage, in this age. So obviously they will get for chances for STIs. 15 to 24 years age, teenage, young age. So which type of the age group people are mostly affected with STIs? 15 to 24 only. So unprotected sexual contacts. Why? Because whenever after puberty there is by the developing of the hormones, so they need to impact on different types of the aspects in our society. So there is a chance for more sexual intercourses without protections, without unprotected sexual intercourses with multiple partners. There is a chance for STIs in the group of 15 to 24 years age. So be careful. Prevention is possible. One could be free of these infections by following the simple principle. Prevention is possible for STIs. Prevention is any type of the diseases or infections. Prevention is better than cure. Now the people are suffering with corona. So after getting of corona, there is no proper treatment. In cases, some of the death also, fatal cases also takes place. So why we are undergoes lockdown? So why we are home quarantine, all the members? So prevention, there is a preventive methods. So prevention is better than cure of any type of disease. Before infection or disease, getting of the infection or disease, you should follow the prevention methods. Then it is very best. As like after the infections, there is usage of medicines and vaccines. So prevention is possible. One could be free of these infections by following simple principles. There is some of the principles given for STIs. By that, STIs could be prevented. So not treated, not curable. Prevention methods these are, right? So avoid sex with unknown partners or multiple partners. Avoid sex with unknown partners or multiple partners. One person got nice job and nice salary, getting nice salary, withdrawing nice salary, and after that getting married. So sexual intercourse with only his wife, that is very good. And some of the persons are trying to get intercourse with unknown partners or multiple partners. One husband